Hello, good evening, friends. I myself, Dr. Divyasri. I welcome you all for a wonderful webinar series. All India Homeopathic Students and Youth Association, in association with Samragee Homoeopathic Clinic, is presenting Homeovision 2020, a revolutionary homeopathy webinar series. And we are here today with our 10th day. And we had a wonderful speaker today, Dr. Yogesh Niturkar sir. I welcome sir for this webinar series. And I also welcome all the participants, all the delegates, all the students and doctors who are watching the show. Stay tuned. Thank you.
Hi, good evening, everyone. I, Dr. Jalashri Tansde, All India Homeopathic Students and Youth Association, Maharashtra branch. All India Homeopathic Students and Youth Association, Aisha, is one of the largest association of the homeopathic students and youth of our country. This association plays a great role in upliftment of youth and young homeopaths to take the responsibility on their shoulders. This is the association of the students for the students and by the students. The aim of this association is to work selflessly for the upliftment of ailing humanity. We believe in on the phrase united we stand and divine we fall. So this is the right time for all the young pets across the country to come together and work for the betterment of the nation to make the India the most powerful nation by devoting their time and work in right direction for the nation. We organize free health camps, free seminars, free webinars, blood donation camps, and we have also developed our own library which we give to the students who are not able to afford books. Aisha family conduct own 9 OPDs at remote village areas. We also promote scientific and research oriented mind of the youth by publishing their articles or presentations or any kind of literature which is valuable for homeopathic fraternity and for the humanity in our magazine called Homeo Vision. We believe in the importance of time, so our motto is to awake, arise, and work before it's too late because aim says I am always in motion. Our thoughts are our actions, so we believe in having a positive mindset to believe ourselves for rising above the mass for achieving higher purposes of our existence. And I'm going to say a few words about Samragee Homeopathic Clinic. Homeopathy is an base system based on the theory of treating like cures, like homeopathy claims to stimulate healing responses to diseases by administering substances that mimic the symptoms of those diseases in healthy people. To provide the treatment of this wonderful system, Dr. Vibha Mevada ma'am, who is an budding and enthusiastic homeopath, has started Samragee Homeopathic Clinic on 4th February 2080 at Indore, Madhya Pradesh, India. Dr. Vibha Mevada ma'am did BHMS from Nashik University in 2015 and did CCAH certified course in advanced homeopathy and MCAH master course in advanced homeopathy, which are short-term PG course from the most prestigious institutes, the Other Song International Academy of Advanced Homeopathy, Mumbai in 2016, and ma'am is certified yoga instructor, scholar by Yoga Certificate Board, Ministry of Ayush, Government of India. Dr. Vibha Mevada ma'am has been trained under renowned homeopaths like Rajan Shankaran, Dr. Dinesh Chauhan, Dr. Gaurang Gaikwad, and many more, and took many national and international webinars. And her article and cases are published in many prestigious platforms of homeopathy in NJH hpathy.com, etc. By following the footsteps of father of homeopathy, Dr. Hahnemann, rare diseases are also being treated at Samragee Homeopathic Clinic. The main intent of Samragee Homeopathic Clinic is to serve people. Several health camps, medical camps, free yoga and aerobics workshops have been conducted at the clinic as the beneficent to people. There are there is no denying the talk that they do treat here their best to assure the satisfying results leading to a lifeline to better health. Thank you.
Good evening, all of you. As we all know, our today's speaker is Dr. Yogesh Niturkar sir.
So, Sir has completed his MD in Homeopathic Materia Medica from Dr. ML Dhawale Memorial Homeopathic Institute under Mumbai University. He is practicing classical homeopathy since last 16 years at Mathura Homeopathic Clinic, Latur. He is assistant professor in Department of Organon of Medicine and Philosophy at VK Homeopathic Medical College and Hospital, Latur under Maharashtra University of Health Science, Nashik. He has written 88 scientific evidence-based research papers, case studies, and doctrinal articles in national and international reputed homeopathic journals and newsletters. He has presented scientific papers, research papers at homeopathic symposium, congress, conference, and seminars at various places in India like Delhi, Hyderabad, Kolkata, Mumbai, Jaipur, Goa, Patna, Aurangabad, Nagpur, Shelgaon, and Latur. He carried out various health promotions and disease prevention programs. He is co-editor in the Chief of International Journal of Advance in Health Science, that is IASN. He has reviewed homeopathic articles and books also. He is a joint secretary of Samvedana Cerebral Palsy Vikasan Kendra Latur, life member and associate editor of National Journal of Homeopathy, that is NJH, and representative of Vital Informer. He was Maharashtra state leader for International Homeopathic Congress held on 8th, 9th and 10th of April in 2016 in New Delhi. He is a recipient of award from Homeopathic Doctors Association of Maharashtra in the category of the most popular teacher from Marathwada region for the year 2017. So definitely we have a great speaker with us today, and no doubt we are going to learn so much from Sir. So heartily welcome, Sir. I know you are just come up with the COVID, and instead of that, for our you accept our invitation and give us time for today. So we are heartily welcome you and thankful for for your presence today here. Thank you, sir.
Now it's time to bring Dr. Yogesh Niturkar. I just flopped myself. Sir, sorry. Over to you, sir. Sir, is there any problem?
Thank you for the wonderful introduction and the technical help given by Arka Mukherjee and the team of the organizing team of today's presentation. Uh, I am glad to be here. I think somehow the share screen option is not working.
Yes, sir. You just turned off your share screen option, sir. Maybe. Just check out once. The same process, sir. The same process which I
I
have
have
guided you last
selected.
time. Just click on that once again, sir. Just go through the same process once again, sir. Maybe there is a technical glitch which you are facing. Yes, sir. Now it's shown, sir. Just turn on your
It is
slideshow, sir, and now we are ready to go with that.
okay. So just let me know whether the screen is visible to all of you.
Yes, sir. It's visible, sir. Over to you, sir. Sir,
So
it's
now the
very
screen is
visible. Over to
visible.
you, sir. Yes, sir. Over to you, sir.
Okay, okay, thank you.
Welcome, sir.
Just a moment. So today we are going to learn, or rather, we are going to understand altogether the opportunity that has been provided to us by All India Homeopathic Student and Youth Association in tune with Samragee Homoeopathic Clinic. We are going to deal with the interesting topic titled as Exploring Homeopathic Approach in Psychosomatic Diseases, a case-based e-learning module. Before I begin my presentation, I am very much thankful. I am very much happy with the way that Dr. Vibha and her team is doing efforts for the enrichment of homeopathic science and art. It reminded me of my enthusiasm that is still there for the cause of homeopathy and the way she had engaged students, rather learners, I would say. That is why below my name I have written homeopathic learner, because it is the learner, it is the representative who is going to spread the beautiful creation of this healing art to the whole world, and the whole world will get benefited only because of its proper representation on the basis of scientificity and the research approach that the learner can make it possible. It is the learner who will make it possible about the flourishment of or enrichment of the science. So, with this short note, I would like to start the topic. You can identify from the image itself that how we are caged within our thoughts, within our emotions, within our intellect. A beautiful image that I got on internet, thanks to the net, because of which we are able to portray, or we can just keep it our thoughts that what we are thinking in our, or what we are going to present in our presentation. So you can very well understand that without the commitment, without the efforts of our pioneers, whatever Dr. Vibha, whatever Dr. Mukherjee, or sorry, student or learner, or the Jayshree Ranjana madam, or whoever else is associated with the organizing team, not only here but all over the world, it is only because of the pioneers that are there. So I dedicate my presentation to the three masters and other pioneers because of whom we are interacting with each other. So today we are going to classify our presentation. Actually, apart from objectives, I had planned for only two cases and just came across another chronic case, and I felt that I should incorporate this case also. So I took some extra effort in terms of typing, in terms of organizing the material, clinical material that was available with me, and I have incorporated the third case also, so chronic case. I was not sure whether I would be able to complete it, but somehow I had managed, and I have completed the third caselet also. So we are going to have a good time, and I assure that you will be taking a integrated message and a working model as a conclusion. This is what we are going to see in today's presentation. So before we begin, I would just like to quote a quotation by Dr. H.A. Roberts. What he feels or what he says: homeopathy as a profession carries a challenge, but the possibilities of its art is infinite. So this is the very essence that as a student, as a learner, as a representative of homeopathy, we should take up various challenges. Now, challenge means in terms of application of homeopathy in various clinical conditions. And these clinical conditions, we have to define what scope and limitations we are having as a practitioner, and in what way we can help the suffering humanity. So the challenges are there, they are in each and every field, but our field is dynamic. So the possibilities of its art are infinite, that we can understand, and we will learn that also. So we have to define objectives. Once we are clear about what we are going to do, we will be able to understand the whole process. We will be in a position to integrate various knowledges. So the objectives are very essential. Aims and objectives play a pivotal role in defining and representing our thoughts, our actions, and it will help us to make our action justifiable. So, the objectives of today's presentation in that tune are learning how environment plays an important role in the genesis of psychosomatic diseases. Now, under these three cases, we will able to find out a purely psychological case, then we will go towards a psychosomatic acute case, and then the psychosomatic chronic case. So it is a mixture of three various dimensions that we are going to see in today's presentation. The next thing that we are going to study, the objective for that is learning the significance of how knowledge of underlying psychopathology influences approach to psychosomatic diseases and its homeopathic management. So whether the knowledge of psychopathology will influence us in terms of approaching towards the disease and its very homeopathic management. So with these two broad objectives, we will see how knowledge of processes will influence analysis and therapeutics. Because after case taking, it is the analysis and the selection of therapeutics that will help us in formulation of results. It will work as a base for producing results. So let's see the first case where we are going to see the impact of lockdown as well as the impact of watching television during lockdown. So this is such a scenario that all of us have came across. You might have seen patients related to this. So let's see in what way it affects the psyche. On 28th of August, around 9:30 p.m., this was a case of our neighbor where Mr. Master K, a 13 years boy, he had sudden onset of weeping and getting irritated of whoever is approaching him. He was not at all pacified. Whole of his family member was shocked with sudden change in behavior. And due to the loud noise, we stepped out and went to their home in terms of to understand what has happened. why there is so much of noise, why there is so much of weeping that we were able to hear, because the home is next to us. So we moved there and we tried to understand the phenomena. Irrespective of the place, a person who is a homeopath, he will start observing. So I started observing what is happening. So the observations made at that time, where boy was moaning, he was weeping and saying, I will die soon. Please don't come near me as I am okay, but I will die. Leave me alone. So this was what I observed. This was the first observation. And the second thing that he was mentioning was he was pleading for not to approach him and was avoiding to talk if anyone was trying to talk with him. My dear friends, observations are very crucial, and as a homeopath, we should learn how to observe. How to observe? This phenomena of observation will start by observing. Now, whom to observe? We should start observing ourselves first, then the near ones that are with us, and then we should start observing our surroundings, what is there, what is normal, what is abnormal phenomena that is going on. So this is a process, lifelong process, that one has to adapt. So after these two observations, I also found that the boy is holding his mother very tightly. So with these three observations that the boy was having in terms of sudden change in behavior, so what might be the probable cause? You can mention it in the chat box. What might be the thing? How to go ahead? So what is essential from homeopathic point of view? What I was talking about observations in earlier slide, it mentions about the unprejudiced observation that Hanuman has given in sixth aphorism. Now one has to concentrate upon the causation. So the observation related to the cause. So the Hanuman mentioned useful to the physician in assisting him to cure are the particulars of the most exciting cause. I hope we are all of you are with me. So this is what we have to concentrate now. We have to evaluate. We have to understand what may be the probable reason why this child is behaving like this. What might have happened. So now we have to go into the depth of the exciting cause. And if you go back to Stuart Close in his chapter on scope of homeopathy, there is Drake's proposition, which talks about that homeopathy in health relates to, means it talks about that homeopathy is not having any scope where the condition, means the exciting cause of that particular condition is still, or it is constantly present and operative. So it relates to no affections of health, what he says. Drake's proposition, it relates to no affection of health, where the exciting cause is constantly present and operative. So unless and until we are not going to understand the dynamics of exciting cause and the expressions that are produced because of this cause, it will be very difficult to move ahead. So from that point of view, I inquired about anything similar that had occurred or read in newspaper or watched on television. Parents said, these days all of us were watching news off. Now news off means automatically you will be very much aware about what we had watched during COVID-19 lockdown. So the news that were related to COVID-19 and Sushant Singh media coverage. So this was what we had observed. But whether all of us all of us have suffered from the news, it will require certain predisposition, it will require certain tendency, it will require some sort of disposition, or we can say a constitution that will affect a particular person under particular set of situation or circumstances. So we can understand the exciting cause over here after hearing and watching a story like related to COVID-19 or Sushant Singh media coverage that made him to feel traumatized, an emotional shock. It is a stress when we watch certain negative news and on a constant basis on day-to-day trial, a media trial that was going on related to Sushant Singh and how to manage COVID-19. So everything was going on. So such kind of news, negative news, or such kind of horrified news can have impact on our mind, that is on psyche. So it is nothing but the emotional shock that is produced because of the stress, which was like a bowel filled with or a vessel filled with tight balloons or something which will explode. So the stress related to these news, which was generated because of continuous watching and listening, and it led to stress, and the child started feeling traumatized because of the negative. I directly came back, took arnica 1 m 4 pills, and I gave it to the parent and told them, please give it. Arnica 1 m 4 pills were given at stat. As a learner, no doubt you will have questions in your mind. Why arnica was given? What are the indications of arnica in such cases? I remember very well during our postgraduate cases where we had seen multiple cases related to emotional shock, acute emotional shocks. And under that, we had very frequently referred arnica in various resource books as well as commentaries. And in that, we had prescribed in such cases of emotional shock arnica very frequently. And that experience was means once you have learned something, it will be lifelong learning. So I gave arnica montana 1 m 4 p stat. Now one needs to understand what is this teenager suffering from. Is the teenager's response is proportional to the perceived stress? That is what I was talking about the earlier slide, that all of us have seen news or watched news or listened to the news, negative news, but whether our response was proportional to the news or it was something beyond our proportion. So one needs to introspect in terms of understanding what kind of response is thrown, what kind of susceptibility the person is having, and in what way it will affect the patient as a person to that particular situation and how he is going to react. So this will demand anamnesis, that is restudy of the whole case. We need to restudy the whole case now. Unless and until we are not going to restudy the case, it will be difficult to understand why arnica was prescribed. So for understanding this dynamic prescription and the dynamic remedy that we are having in high potency, why high potency was given, so there will be n number of questions that will come across our mind, and we will be curious enough to understand what are the indications, on what basis, what is the diagnosis, each and everything that should be answered. So let us see what comes in front of us. So what is available to us? So this is organization of how to organize. It is a skill. We have to organize the data, whatever observations are there. Not necessarily every time you have to sit with a paper and pencil or pen and you have to write it down from the preliminary data to XYZ details. Many times the situation comes that you are not with any pen or you are not having any paper, but the thought process has to be there in terms of how you are collecting data and how you are processing that data. It should be a day in and day out methodology that one has to adopt, one has to practice, so that standardized homeopathic practice and education can be made available to all of the fraternity. So in that sense, let us try to understand what is available to us. So the first thing is that cause, the exciting cause that we were talking about in earlier slide, exposure to news that are negative and frightful. So what it has created? It has created a virtual environment that led to interpretation of, considering that whatever is shown, whatever is narrated or narratives have gone, whatever is there, it is reality. So the perception is at the level of reality. There might be some errors, there might be some fiction in that, there might be some cocktail story that has been put up in front of us. But as a mind, as a tender boy, as a tender at a tender age, in what way I am looking at these situations, how I am interpreting these things, my dear friends, it will make some sense if we are focusing upon such aspects in terms of what kind of perception the patient as a person is having. So it is considered as reality. So what are the expressions that are available to us? The expressions are at the level of mind. The pathology that has been produced is of functional nature. And the another thing that we need to concentrate upon is what kind of presentation is there or the expressions are there. We are able to judge that at mental level we are having expressions, and acute stress is there which has produced functional disturbances. Now let us see what kind of presentation is there, that is the qualified mental journals are there. So the data is organized in such a way that we can understand conation, affect and cognition. These are the things that we should understand when we are dealing with a psychiatric case, whether it is purely psychiatric case or psychosomatic case, means whether it is only affected at mind level or it is a combination of mind and body and an integration or an interaction between each other, or it is purely or predominantly somatic manifestation with underlying psychotic phenomena. So we need to understand conation, affect and cognition, so that will be very much helpful. Now I have organized this data. This is what we do at our daily practice, which we have learned at Dr. ML Dhawale Memorial Homeopathic Institute, Palghar, during our post graduation. And in its various books on philosophy or standardized homeopathic practice, the cases that are put up, the cases that have been explained, or the theoretical part that has been given. So if it is a psychiatric case, we can organize data into conation, affect and cognition on timeline basis, so that we can represent the evolution of that psychosomatic or the purely psychiatric cases at a miasmatic dimension. And if it is a pathological, means in terms of the particulars or physicals, we can make it as a structure, form, function. So here the behavior that we had seen, that is conation, we had seen was moaning, weeping, pleading, frightened easily, holding his mother tightly, wants to be left alone, aversion to talk. So, my dear friends, you can easily find out what is there in the case. What is the thinking that has produced such kind of behavior? It was death is approaching. I am going to die. So the emotion that is seen is fear of being approached. So the behavior, thinking, and emotion, we can clearly make it out. It will give some sense in terms of understanding the expression, the qualified mental generals that are there. So the totality that is available to us, ailments from emotional shock, fear of sudden death, that is there, fear of approaching others or fear of being approached, frightened easily, pleading behavior, aversion to talk, desire to be alone. Now, these are the manifestations that are seen there. So, the disease classification is acute. The disease diagnosis is acute stress reaction. You can read it, you can refer it in psychiatric textbooks, or you can just search it on internet. You will find about acute stress reaction. And the international classification of diseases 10th code. So the ICD classification 10th version talks about F43 and the 11th one Z. So under this classification, it has been given this coding for acute stress reaction. So let's see the miasm due to the hypersensitivity, the level of susceptibility. We can judge that the psoric manifestation is predominant in this case. The type of reaction that has been done, the manner in which expressions are available, these are all functional expressions. And the response that we are going to find here is fight, flight, and freeze. This is what we are able to find out. So, what has happened after exposure? The defense mechanism that one has is of fighting. The person fights with the whatever inputs are there, and then he tries to cope up. If it is not possible, then the flight response, that the expressions that they are given, and the freezing stage comes where he is not able to judge what is happening to him and how to control his emotions, how to control his expressions, and that leads to formation of such kind of responses. Now, with the help of modern repertorizing tools, we will just try to understand the manner in which rubrics are there in different repertories, and in what manner we have to select with the help of cross repertorization that we are going to see in the next slide. So the ailments from shock, emotional, mental. I remember very well from my PG days, whenever we had searched, we used to refer to the hard copy of Murphy. So only Murphy is having this rubric. It is not in Kent, it is not in complete or synthesis. So I had referred these four repertories, and it is given only in Murphy related to ailments from shock, emotional, and mental. So when we are repertorizing, we are searching for the exact rubric that suits to our, or that becomes simillimum to our totality or what we are thinking about. So we were thinking about shock, emotional, mental, and in that Murphy talks about this rubric. Fear death of sudden, it is given in all rubrics. Fear approaching him of others, it is also there. Frightened easily is also there. Now the two rubrics means the two symptoms are combined here, and it is only in two repertories complete and synthesis. The modern repertory is what we call upon. Spoken to aversion to being, alone desires being. So there is aversion to speak and there is desire to be alone. So when we are getting these two symptoms in one rubric, for that what has to be done? A simple advice to all my dear learners, which is applicable to me also. Whenever you are seeing any case, see to it that whatever symptoms you are looking for, whatever totality you are forming, make it an habit, whether the remedy is known to you, make it a habit of referring repertory and reading Materia Medica side by side. Let the patient wait for 5-10 minutes, but don't take up your opportunity of learning homeopathy. So it is a triangle where you have to study Organon, repertory, Materia Medica, and inside of the triangle you have to keep the allied subjects. So these were the rubrics that were considered, and this method of cross repertorization or referring to various repertories will definitely yield results. So see, with the cross repertorization method where we are taking up, I was thinking of taking a Kant's approach. So the totality was formed in that way only, but there are certain limitations of repertory. So we needed to cover the repertory from Murphy, Kent, and complete with an view, so that the totality will be. It is called as cross repertorization method, that we are looking out for other repertories where we are not getting the rubric in one repertory. So you can find out that Arnica is covering the whole totality. And my dear friends, you will agree and you will be surprised if you have not learned this aspect of Arnica, because we are used to prescribe Arnica only in physical injuries. But what about the mental injuries? Trauma is nothing but the injury itself. So what has happened to this boy? And in what way the trauma has affected? So let's pursue mind of Arnica. So from these three books, Materia Medica Pura, Lectures on Homeopathic Materia Medica by Kent, and Materia Medica of Homeopathic Medicines by Dr. Fatak. So all the other pioneers have also talked about Arnica, but I purposefully took up one resource book and two commentaries so that we can understand the Arnica at the time of proving. That is the resource book, and the two books, these are experiences, what they had seen. That is why I have taken the approach of selecting a resource book and two commentaries. So let us see what was there in proving of Arnica: severe attacks of anxiety, anxious concern about the present and future, excitable sensitive disposition, into the bracket whatever names are there, these are the names of the prover that anyone used to write it down. Abbreviations are there, and you can find it out in Materia Medica Pura. Before we start with each and every remedy, you will come across the name of provers who were involved for the sake of proving. So, severe attacks of anxiety, anxious concern about the present and future. So, what this boy was saying, what he was having, he was having that concern, the anxiety. Behind that concern was anxiety about the present and future. That what is going to happen? this is the scenario. What will happen to me in future? So he was predicting the future out of anxiety. Excitable and sensitive disposition. Unless and until there is no sensitivity, we are not going to see such kind of reactions. So we are able to see the excitability and sensitive disposition. The next thing is fright and starting at unexpected time trifles. Hypochondriacal anxiety is there. Oversensitiveness of the disposition. Extreme inclination for agreeable and disagreeable mental emotions. Are you getting the point? Oversensitiveness of the disposition. And that is leading to extreme inclination for agreeable. Means where we are coming, yes, it is like this only. So we can agree with the presentation. And another thing is that disagreeable mental emotions. Now, what it means, for example, a child of 3 years is crying because of certain demands like chocolate. So we agree with that situation, that inclination, that yes, the child is age appropriate, and because of that, the demand is acceptable. But what under disagreeable? No. A boy of 15 years or a girl of 15 years is crying because of chocolate, because nobody is giving her chocolate. Irrespective of the level or intensity of craving, it is disagreeable. We will not agree, we will not come to a point, or we will not conclude, or we will not agree with that kind of emotion because it is not age appropriate. My dear friends, we have to understand emotions, we have to understand intellect, we have to understand the behavior, and we have to think about what is the thought behind that on the guideline, that whether it is age appropriate, whether it is gender appropriate, whether it is profession appropriate. That will help us in terms of understanding the disposition. So fears are there, anxious, dread of coming evil. So you may agree with what the presentation was there, what Hahnemann talks about, the anxious dread of coming evil. So the wording that is available in patient's narration or observation that we have seen, that what is it? Approaching death is nothing but an anxious dread of coming evil. Something bad is going to happen to me. So that is what Hahnemann has stated. It is just a glimpse of mind that I have picked up, which is applied in this case in terms of understanding patient as a person at acute stage. Now let's see what Kane tries to explain. He says that the Arnica patient is morose, wants to be let alone, does not want to be talked, does not want to be approached. This is what the observation Kent has made. So he does not want to be approached both because he does not wish to enter into conversation, a mental state. So he does not wish to enter into conversation. The moment the probable conversation will happen, the possibility of weird expressions can be there, and the emotions are so predominant that it restricts conversation. Conversation will lead into opening of new concept. It may be opening up of corrections of our behavior. It will be opening of some new avenue. So emotions doesn't allow to enter into conversation. That is the mental state that these Arnica patients are. And in the third commentary, especially in the third reference book, Fatak sir has mentioned that this is the remedy par excellence, especially the traumatic remedy as a traumatic remedy. Now, trauma in all its varieties, mental or physical, and their effects, recent or remote, are met with this remedy. whether it is acute or chronic, it can be met with this remedy. So remedy response evaluation, after 10-15 minutes of the first dose, he stopped crying and sat calmly. Within half an hour, asked for water and had a peaceful sleep. Next day, arnica 2 doses were given as advised, and everything was normal. And I observed in the evening that he was playing badminton with his younger brother. There were no symptoms. Everything was normal. So there was no medicine given. Only 3 doses of arnica restored the person, the sick individual, to health, towards cure, what we are talking about. So whether we are able to live up the aphorism number one, the mission of physician, the high and only mission of physician is to restore the sick to cure, restore the sick to health to cure, as it is termed. So we are in a position with homeopathy. So this is the first case. I hope the overall presentation up till now is very much clear in terms of how we are proceeding towards what is the role of observations, and in what way the anamnesis or restudy of case will allow us to understand the concept, what kind of presentation is there, and its cross check with the help of repertory, differentiation with the help of Mathura. So here we are able to demonstrate the problem definition, what kind of complaints are there, problem resolution, and the interview plan. So these are the things that are key to standardized homeopathic practice. We also learned acute cases should be traced with cause effect relationship. In acute cases, cause effect relationship will help us in building a totality of symptoms. It will define approach, what kind of approach we have to select, so that we can arrive at the simillimum. So knowledge of physician will help us to define scope of homeopathy. So this is what we have learned in the first case. Now let's see the second case. A 40 years old female complained of non-productive cough from throat pit since 5 to 6 days. Aggravation was day and night. Dryness of throat with mild increase in thirst. History of treatment, anti-allergic and antitussive from dentist husband, which led to partial ambulation. Now thermally patient is chilly. Now these kind of complaints were very much predominant during the lockdown. This is the second case that I had selected, which belong to the lockdown period, so that we can relate very easily with the scenario and what kind of emotions are attached, what kind of somatic affections are there. It can be very well understood, and the manner in which we can proceed ahead in terms of selecting simillimum. So this is a short presentation where we are able to find out the complaints are very clear. Non-productive type of cough is there, arising from throat pit. Onset is in 5 to 6 days. Aggravation is only one, day and night. There is dryness of throat with mild increase in thirst. So this was the opening. Patient narrated that these are the things, and I have also inquired few of the things, and this was the presentation. Now this case was uh, very much relevant at that time, where we had various issues, various concerns about self, about our family. So what are the relevant points from the history? You can easily understand from the pic itself. Husband is a dentist, and since last week he is attending his patient. Now this was the case which I had seen after the lockdown. First lockdown was over, and where the husband was joining his clinic, he was seeing his patients. So as we had so much of WhatsApp data, we had Facebook data, we have television data, we have newspaper data, we have interactive data that was done within the family related to COVID and the threat that all of us had. So the patient had husband's risk. She felt that husband is at risk of exposure to COVID-19 and its fatal outcome. What if he contracts the disease? This was the thing. This was the scenario that the patient had. What will happen to her and children? Again, dread of coming evil. We can understand. Don't worry, I have not prescribed arnica in this case. The next thing, the next part, insisting her husband to avoid going to clinic, but he is not listening. There are contradictory states. Many a times we have dual thoughts. We are not in a position to make a judgment, and our emotions dominate our thought process. That is domination of emotion on intellect, and will lead to making some weird combination of thoughts, weird presentations. So she had conflict. What kind of conflict we will see? She was insisting that husband should avoid going to clinic, but he is not listening. Also feels if husband will not work, then how daily needs will be fulfilled. Now this is something that every family member during COVID had when the earning member was sitting at home, especially in the below poverty line, or above poverty line, middle socioeconomic class, lower socioeconomic class. So all of them had this anxiety that what will happen, how our daily needs are going to fulfill because we are at home since so many months, and what will be the fate. So these dual thoughts were there. So we can see the anxiety in this lady, so that the anxious thoughts were not allowing her to send her husband because of the fear of contracting a disease that is deadliest, and underlying anxiety about the future that is attached with the well-being of husband. What will happen to her and the children? Obviously such kind of anxiety is going to there, it will born there because of the situation, because of the financial state. So let's take a quick assessment. Patient evaluation. Conflict. Expectation from husband should stop attending his clinic. The type of conflict. Approach avoidance conflict. How to fulfill daily needs and don't want husband to attend clinic. So these were approach avoidance conflict. You can refer these terms, and these are very helpful in terms of understanding patient as a person and what kind of emotions are generated, what kind of effects of these emotions are there. So we can find this approach avoidance conflict where we want to, means again a duality of thought, we want to do and we don't want to do. So that is the thing. So emotions like anxiety and fear of impending disease, effect of emotions, psychosomatic, mental cause, physical complaints, cough. So whether the disease diagnosis belongs to the psychogenic cough, where the ICD classifies it under other somatoform disorders. So this was what we had learned. We had a special e-learning webinar series, psychology series at Latur College. We had organized with the Department of Psychiatry, and my younger colleague, Dr. Rajesh Yadav, have very beautifully narrated this concept of conflict. So after repertorization, we can see fears, phobias, general disease of impending. Again, this rubric is only in Murphy. So the next thing, anxiety family about is anxiety cough from dryness of throat and the stomach thirst increased. So phosphorus, arsenic, hepar, nitric acid, these are the closely coming up remedies. We can easily understand from the totality, the symptom coverage and the sensitivity of that lady, a typical sensitivity that she had, the anxiety, the concern about family, and the expressions that are produced. And you can see anxiety cough from, there are only 12 remedies. And out of these 12 remedies, you can easily find it out phosphorus, nitric acid, and aconite are the initial three remedies amongst whatever six remedies are there, seven remedies are there from phosphorus to sepia that I have shown. Among seven remedies, the phosphorus, nitric acid, and aconite are the three remedies which are covering these, which are covering the symptom anxiety cough from. So patient management was done with phosphorus 1 m TDS for 3 days, and follow-up cough was totally ameliorated. There is no dryness. Anxiety was absent. She was feeling much better, relaxed, and she was restored to health. One more important observation was that she mentioned. She supported husband for his medical service in such kind of pandemic. Are you with me? You can understand what kind of deep impact this medicine had on the psyche of the patient. That he came up with a change in thought. He came up with change in behavior pattern. Her anxiety was settled down, and that led to, means she was relaxed. She was free from the anxious thought, and she was able to think in a concise, in a conscious way, that what is right and wrong. And she supported husband for his medical services in such kind of. So this is the result that we can see. Okay, let's move on. We have 28 minutes and we will cover up another chronic case. So in two acute cases, we are able to find out a purely psychiatric dimension. Psyche is predominantly affected. And in another case, we are able to find out the psychosomatic expression. What kind of psychosomatic expressions are there in acute stages? Now, it is demand on the physician that he should concentrate upon how to record, how to analyze, how to restudy, how to inquire the whole process, and how to analyze, how to evaluate whatever information the patient has narrated, whatever observation the physician, attendant, what kind of inquiry physician has done. All these things has to be explored in a proper way so that we can yield results. So this is what we can find out. So let's move on towards third case. A 38 years old businessman. He was accompanied by his wife, and they consulted for complaints of migraine and low mood that was going on since 2 to 3 years. The 38 years old man, who belonged to a high socioeconomic class, happy-go-lucky family comprising of father, stepmother, patient, wife, and 2 children. So this is the scenario. Now the presentation. You can just imagine from the slide itself that there are two types of complaints. One is migraine and another one is related to the state, the melancholic state, the complaints that are purely psychological, and one is purely somatic, that is physical. So at physical level, we will see Both the complaints have started, physical and mental complaints have started since 2 to 3 years after death of mother and remarriage of father. What has happened? After death of mother, father had remarried, and the complaint is having a close association of expressions. Time bound expressions are there. So migraine, headache, alternate side, frequency 2 to 3 times a week, 4 to 6 hours of duration, no relief with allopathic treatment, and the complaints, the pain was aggravated by noise, a common pathological modality in migraine, same way in light, sidewise aggravation night. So family history, mother, sorry, before family history, we'll go to the next part, that is observed in his own word. Delayed reactions are there, silent but irritability is seen towards wife and children, those who are less threatening, those who are junior, and those who are weak from the patient's angle. And he is bringing out his irritability towards wife and children. Business aversion is there, indifferent, disturbed, not interested to talk, suicidal thoughts, and all these complaints are having a slow progression. We are able to see that family history of cancer is there. So the physical generals, there was nothing as such in terms of physical generals. Only thing that I observed was his careworn facial expressions and constipation, disturbed sleep, and dreams of being prosecuted. Let us see the life space. High socioeconomic class is there at social level. I am just presenting the glimpse of case. The family is having interpersonal relationship problems between mother and father. So there was issue at family level between parents. I'm talking about the real mother and father. So because of that problems, interpersonal problems, the marital disharmony was there, and because of these issues, he was not mixing with others, and he became reserved since childhood. Parents were good business colleagues, but poor and strained relations as husband and wife. See, this is the irony in any relationship where we are good at one term, but we are not good at another level. And to add on, 4 years back, means at the time of onset, near about onset of the complaints, mother died. Patient had a strong bond with mother. She was like a friend. Father remarried at the age of 55 years. Stepmother is of 53 years, divorced due to she was not having any issue. That is a common practice in many parts, especially when we are talking about a lady who is of 53 years. It was common practice, which is totally idiotic, illogical, and not supported at any or from any angle. Okay, so coming back to the another area, that is work area, he is very responsible towards his work, but there are certain pending court cases, projects are not working properly, whatever business projects are going on, there is no smooth functioning. And at personal level also, he had one setback during his college days. He had a crush on one girl, and unfortunately it turned out to be disappointment. So what kind of role we are having in terms of understanding the patient as a person in different areas, social, family, work, and personal area, so that we can understand the evolution of disease. We can understand the genesis of disease. So let's see. During interaction, I was means both were invited inside the cabin, and it was a interaction where there were inputs from the husband. Means I was listening to both of them. Patient versus wife location. At some moment, I made one of the partner to sit outside and try to understand or try to cross check, and I observed that there is different location related to the issue of father's remarriage. In what way patient is looking and in what way wife is looking. So what is the location of patient and his attendant? That is also very crucial. So patient felt that the remarriage of his father is a cheap action. It is a humiliating thing. It has destroyed the family and shameful. Now, because of this action, the interpersonal relationship with father and stepmother is strained. He is not on talking terms. Only at business issues she talks with the father. Now, what is the location of wife? Now, she was trying to understand the situation. Now, father had remarried and he needed a companion. What is she was trying to focus upon? You can't understand him. There is nothing like right or wrong in love. All is fair in love. And she had accepted. What value we are giving to a relationship and in what manner we are moving ahead in favorable and unfavorable circumstances so that we can live in a peaceful way. How to approach to any situation defines or it depends upon the disposition also. So this lady, because of this approach, because of this thought, she had a good interpersonal relationship with father-in-law and stepmother-in-law also. So there has been a bond, a positive bond, and both of them are also treating her in a very good manner. But the IPR with son is straight. I made a physical examination. Everything was absolutely okay. Now the main important thing is that about the mental state examination that one has to carry. Now see, I am bringing out different concepts. In first case, we were able to understand the importance of observation, the approach that one needs to define, and one of the essential thing that the need of referring repertory, Materia Medica references, and the association with the results. In second case, we were able to understand the concept of anxiety, the concept of how conflict is understood, and in third case, we are here trying to understand how a chronic case in nutshell can be presented and we can understand how it is evolved. Means how we are trying to explore each and every aspect of that patient in nutshell, and we are trying to find out the role of attendant as Hahnemann has mentioned in 84th aphorism related to what observation, what changes, what kind of changes the attendant has observed. We have to note it down. So from psychiatric point of view, mental state examination is very crucial in terms of appearance, behavior, speech, mood, perception, thought form, thought content, cognition, and the insight type. Now, this will give an idea about the level of disturbances that has been caused. Okay. So, appearance, age appropriate, moderate physical condition, behavior, mild anxiety, distracted easily. Speech was at fast rate, mood was low and calm, perception was poor at many instances where we were able to get inputs from the wife herself. So thought form was emotional with logical association with facts. Content of thought was very much fixed about the actions that has been taken by his father and the loss that he had because of the death of mother. The cognition that we are able to find out, attention and concentration was level of comprehension was moderate, attention was also moderate, orientation to time, place, and person was good, and the insight was average and blocked at one level only. That is the issue of or the shameful act that he felt, he perceived. Now we can reflect on nowadays change in culture, and there are certain issues that one needs to address, and there are certain new normals that are also there, and we have to at some point we need to move ahead, and it is again a part of disposition where we are having different kinds of personalities having different set of priorities, but how we are taking it as a third person or directly related to that person, it depends on our insight. So what kind of insight the daughter-in-law is having and what kind of insight the son is having, on that basis we can define the problem itself. Now throughout the interview I was able to understand this wife and husband, that they are having a opposite, or we can say a contradictory personality, opposite, where the wife and husband can be compared in a such a way that we can understand their manner of adaptation. Excitable, wife is excitable, husband is depressed, wife is talkative, is silent, vivacious, and as if no life, curious, indifferent, extrovert, introvert. She is more of a childish, is more of serious. The temperament we can discover from this is sanguine, wife is of sanguine temperament, and husband is of melancholic. Okay, so we are taking case of one person, side by side another person is giving his own case or her own case. So it is the skill that the physician has to develop over a period of time, which will help us why a person is having a such kind of reaction pattern. Now you can very easily understand, because of such kind of features, that he is very much serious, he is sad, he is melancholic, and that is why he is thinking from that point of view, and he is brooding over that issue, one circumstance, and he has blocked himself. Whereas the another person of opposite temperament is accepting that, or she is looking at the same thing from a different perspective. So because of the two different temperaments we are able to see the different reactions also. That is why homeopathy believes in individualization, and that is the reason that we need to inquire each and every aspect of that person. The case is having a different dimension. The disease diagnosis, which was already a psychiatric diagnosis, was formed from the psychiatrist, that I will point it out, at the onset of disease, as well as when the disease was progressing. Initially patient has taken treatment from psychiatrist, and somehow it was conveyed to the patient and the patient's wife that you should go for some sort of homeopathic or ayurvedic treatment complementary treatment or the second line of treatment. And for that, after searching, they came to me, and I was very much fortunate to understand the different dynamics, the story that they had in their life, and the reaction pattern. Now, from the whole presentation, I have reduced the whole phenomena into this, where we were trying to understand the cause effect relationship in terms of what has happened to this person at cause level, remarriage of father, death of mother, and disappointment in love. The cause effect relationship we can understand from that. Already the symptoms have been mentioned earlier. As a person, he is very hypersensitive, sensible, reserved, brooding past events. The diagnosis that we had was of migraine and major depressive disorder, unipolar, which was a diagnosis made by the psychiatrist. So miasmatic level understanding was of functional sora and destruction psychotic. So predominant sora psychotic features were there, mixed combination, functional disturbances, and the destructive thoughts that he had in terms of suicidal ideation. Now we can see, because of the fixed ideas, because of the suicidal tendency or the block that he had, there was a predominance of psychosis. Whereas the rest of the functional complaints and or the sensitivity part, functional disturbances were more of a soric. So sora to psychosis, a combined miasm or a mixed miasm, what we say, was there in this case with predominance of psychotic features. He had a confidence which was poor to adequate. He is a person oriented man. He is having potential, capacity is there, but performance has decreased because of the block, because of the fixed ideation, the emotions that were dominating the intellect, and the performance was blocked at family, work, and social level, along with emotional and good IPR relationship with mother. So it led to the block. Efficiency and satisfaction was decreased, and there were problems of adaptation. Now we have to define the problem in terms of therapeutic management and resolution of this problem. The disease diagnosis we can understand is of migraine in MDD unipolar type, chronic disease. When we try to understand the clinical psychopathology, it is functional, reversible, curable. And if the person is not following what has been advised, or if some similar set of symptoms, similar set of situations, or some kind of little bit of change in situations can be there, or stressor can be there, it can be a recurring type also. So it will depend upon how much he had come out of his earlier past incidences and how he is taking up the situation. So since childhood, we are able to see that there is some emotional suppression in this case. Totality is of predominant mental generals, miasm, psychosis. In totality, there are few physical generals also, but there is a predominance of mental generals, miasm, psychotic, anti-miasmatic remedy, thuja, correspondence is total, prognosis is good in this case, general vitality is also good, susceptibility is to moderate to high, sensitivity is high, and potency and repetition is also high, so it will require infrequent repetition. So this is the plan. And with this totality, the thing that I had considered, the humiliation that he felt, was the symptom, humiliation at the level of interpretation. When the father used to fight, it was also one of the shameful act that the parents had in front of the child. And the next add on, in terms of the remarriage of father, after the death of mother was something which he felt humiliating, something which is an abuse to the relationship that he has thought about. So that is why I have taken this rubric. And second thing, the silent grief that was going on, which needs resolution. Brooding behavior is the dispositional feature. Reserved mood is also there. The conscience, the conscientiousness of trifles, related to trifles, physical generals, appetite, general loss of appetite. We had seen the constipation. Again, inactivity is seen at physical level too. And headache, a characteristic type of pain at the sides of head, which was having aggravation at night. And only few remedies are there, and in that natrum stands out prominently with this totality. Some may think of ignatia, some may think of staphysagrina, but when we talk about these closely coming up remedies, just not about the number of the totality that it has covered, but we need to understand Materia Medica image of natrum move. And with this totality, with this evolution, what we had seen up till now, it is very much evident that natrum mur is the simillimum remedy. In other phases, in future, he may need, if there is such kind of psychological breakdown with some somatic affections, he may need these closely coming up remedies also as a phase remedy. But if we think about the chronic and the acute presentation, acute in terms of what phase right down is there, the phase that he is having right now, and the dispositional qualities that are seen or the features that are seen, we can have the remedy. Means I may say that ignition staff may act at partial level in this case. It may differ in another case. But with this totality, I have prescribed natrum mur 1 m weekly single dose for 4 weeks. With this first follow-up, migraine was ameliorated. There was change in behavior. There was change. There was some sign at the level of interaction with father on 2 to 3 occasions. His mood was improved. And with this finding, I continued the same treatment. In view that the migraine should stop, so that the psychological load needs to be relieved, the openness of interaction, the openness of channel of interaction was seen, and with that I continued. And in second follow-up, patient was absolutely better. I was surprised within short 2 months of treatment. In between, he used to talk me on phone. That means psychotherapy has also helped. But within 2 months, all mental complaints were ameliorated and there was no episode of migraine. So from this onwards, he continued with me as an off, as per the need of the treatment, as per the need of the follow-up. Action was taken, whether acute remedy for the acute episodes or the chronic repetition was also done. So this was the case. Now the purpose of this whole presentation in terms of what we can take home as a message, integrated take home message from this presentation. And I have incorporated this from Hutchison's Clinical Medicine or the Clinical Methods, the textbook, about what we can learn or what we can, in what way we can approach to the patient as a person. So the physician's first aim or the physician's aim at first consultation has to be in terms of diagnosis, understanding the nature of the patient's perception of the problem, And the requirement for this will be in terms of application of aphorism number 1 to 291 with the help of repertory and HMM to arrive at the remedy. Now, what is needed? Whether it is allopathy, homeopathy, Ayurveda, Siddha, Unani, etc., etc., we need to establish clinical features by history taking. That is, we have to build up some sort of clinical database. This is the scientific way, or this is the scientific approach that one has to follow. We need to have knowledge of disease. We should have knowledge of pattern of disease presentation. In what way the disease is coming up, and what is the link behind that disease? What is the thread that is thrown, and in what way we are able to encircle the thread in such a way, folding and unfolding of that thing, of that event in such a way that we can understand the whole phenomena, the pathogenesis, the evolution of that disease, and what kind of effect it is having at the level of psyche and soma. So we should have that ability to interpret patient's clinical database in terms of symptoms and signs, so that the disorder functions, the potential causative pathologies, whether physical, mental, or social, or a combination of these. So we should be able to interpret all these things. The next thing, important thing, is of concept of genesis of disease. Now, what we had seen in the three cases, two acute and one chronic one, the human being is an integrated whole, acting all the time through mind and body. I'm interacting with you through the channel of mind and body itself. You are involved in this presentation through the mode of mental and physical entity. So the human being from the moment of birth lives in this dynamic environment which is continuously affecting him all the time in many ways. And he is obliged to adjust continuously in order to maintain a dynamic equilibrium. I hope you are with me and you will agree with this concept. Now, this is given in preventive and social medicine, which is for fourth year, and it talks about the role of environment in genesis of a disease and how we are engulfed, how we are interacting with the environment which is affecting us all the time. I will take few minutes and I will finish up the presentation as we have come to the last portion of the presentation. With your due permission, I will continue, and is obliged to adjust continuously in order to maintain a dynamic equilibrium. I am in tune with the time. I am trying to adjust myself. I have increased little bit of my speed. I am limiting myself. So what I am doing, I am trying to adjust. I am trying to adapt to the situation. So if the stimuli are stronger than the organism's natural defense mechanism, what will happen? All of us are aware with this fact. State of imbalance will occur, and that is nothing but the disease. And the state of imbalance will be reflected in the form of signs and symptoms. And this result of struggle can be seen primarily upon the mind and body level, depending upon the overall state of health at the moment of stress. Now, who is saying this? This is modern medicine. Whether we can utilize this knowledge? Yes. In what way? At all, in all ways, at all the times. And the demonstration has been done through the three cases that we had seen today. That in what way we are interacting with the environment, and how the environment is influencing our actions, how the environment is affecting our mind, that is psyche, how it is affecting our psyche, as well as the physical part, that is to say soma, and in what way it is having overall impact on my mind and body, or a combination of both. So we can understand this. So for this, Hahnemann has mentioned that we have to do individualizing examination of a case of disease, whether it is acute or chronic. Now, this is what we had followed in case 1, 2, and 3, though they are in nutshell, but the concept has been shown in what way we can individualize the examination of a case of disease. And for that, there are certain demands on the part of physician that you can refer from 83 to 104 aphorism, the guidelines that are given by Hahnemann related to case taking. So these are also the guidelines. All of you are aware about that. That has been mentioned by Stuart Close or Roberts or J.T. Kane, that we should, I will just focus upon that the second case talked about the physician needs to be good listener. Sorry, the third chronic case, the husband and wife combination that we had seen, the interaction with them, that we have to give our ear to them. We have to be a good listener. We should have a knowledge and value of expressions. What Kent has also emphasized, always emphasized on this key factor, that you should have knowledge of expressions and what kind of value you are having, what kind of value you are attributing to these expressions is very much crucial. So this is the another part. Homeopathic education, you know that aphorism 3 and 4, what it talks about. 5 and 6, training of the physician, and the working model now we are going to see. Now, whatever we had seen up till now, this is the model upon which I am working, my institute is working. Observations. My dear friends, double, triple means you can make it a double underline or a triple underline. So this fact of observations are very much crucial for any sort of medical practitioner, irrespective of the science that he is practicing, whether it is allopathy, homeopathy, ayurveda, etc., etc. He needs to give importance to observations. Because if observations are neglected, then you are missing the essence of that case. Then you are not going to give justice to that particular case. So observations are very crucial because they act as a part of process of our learning. It is part and parcel of our process of learning. So we need to observe. And apart from this fact, the process of learning, observations which are represented as facts, which are there as fact in the homeopathic material. So whatever drug proving observations are there, they have been incorporated into homeopathic materia medica. So observations are very crucial. And it forms a foundation for experiencing standardized homeopathic practice. I hope you are with me. You will agree with these aspects of learning. And observations are also an integral part for not only experiencing the standardized homeopathic practice, but the manner in which correlations can be derived. We had derived certain correlations throughout the presentation at each individual level, at each slide, or at each case. So the correlations are of varied nature. So clinicopathologic concepts that we had seen, or the psychopathologic concept that we had seen. So these things are very essential from a homeopathic point of view or from a homeopathic perspective, because it is a part of continuous learning. That is why my first slide will always say that I am a homeopathic learner. Even today also, means still before the presentation I was working, I was revising this presentation. Now what is the emphasis? That we are trying to learn, we are trying to give importance to each and every aspect of our presentation or our science, not out of anxiety. It was not out of some sort of doubt in mind, but it is on the part of improvising ourselves as a learner, so that whatever sharing we are going to give or whatever sharing we are going to deliver, it should be in a more standardized way. So the efforts are for the extension of our knowledge levels. Whatever knowledge we are having, whatever knowledge we are gathering, it will help us in terms of extending our what level we are having. Before presentation, including me, I was having a different set of, or I was having a different person at the level of knowledge. While preparing this presentation, while dealing with case, every time we are improvising ourselves, we are updating ourselves, we are upgrading ourselves. Today I am with this new website, the opportunity that was given by Dr. Vibha and the whole team. So what we are doing, we are extending our knowledge levels. The thing that we are doing right now, the presentations that we are having, what is it? What is the concern? It is a tri-coordinate care. What is the objective? To enhance our knowledge, to become enriched in knowledge, to have a different perspective, or to try to understand the concept so that it can be applied in patients. It can be useful for those who are unaware about these things. So we are taking a tri-coordinate care of knowledge, patient, and learner. And this is very much emphasized by our founder, or we can say the alma mater from which I have learned these aspects of homeopathy from Dr. M.L. Dhawale sir and his works. So you can refer this book, which is a beautiful book. 3 volumes are there. There is many literature related to this. So you can understand the different dynamics. So this was the working model. So I hope I have tried to cover a vast area within 1 hour and near about 20 to 25 minutes, near about 80 minutes. I have tried to cover up the difficult part dealing with acute psychiatric case, acute psychosomatic case, and chronic psychosomatic case. We're building up a concept how to approach these cases. So, still, if you are having any doubt, I would be very glad to receive your feedback on my WhatsApp number or on my email. If you are having any queries, you can just write it to me. I will be very much glad to learn from you, to have a different perspective related to that. And with this note, I end my presentation with acknowledgement to the team of Dr. Vibha Mevada and the organizing team of All India Homeopathic Student and Youth Association for giving me this wonderful opportunity to interact on this e-learning module that it is going on since 1 week. I think this is the 10th day. So thanks a lot to all of you. Together, everyone achieves more. That is why the team term is there. With all of you, I would also like to thank my alma mater, Dr. M.L. Dhawale Memorial Homeopathic Institute, for the training and education, for building up a vision within me, and my family member who always support me, help me, guide me in terms of giving me freedom to explore the vast armamentarium or the vast ocean of homeopathy. My learners of Vasantrao Kale Homeopathic Medical College, my learners that are there in different colleges in Maharashtra, sick individuals because of whom I am able to explore the possibilities of homeopathy, the graduation college, Poster Development Homeopathic Materia, Homeopathic Medical College, Aurangabad, and my working college where I am serving as a learner plus teacher at VK Homeopathic Medical College, Latur. So this is my extended family. Thank you for being part of my life, and expect that you will always bring out best out of me. And this is just a small contribution towards homeopathy that I can offer as my humble service to the profession because of whom I am in front of you. Thank you once again.
I think Dr. Viva ma'am, I think there is some technical issues with Viva ma'am. Please hold on, sir. And sir, that was really brilliant session by you, sir, and really appreciated. And I hope, guys, once again, let's wait for the uh, speaker to be on screen as our speaker just abruptly went away without without any notice. Viva ma'am, can you just help us calling sir on screen because sir just went away. Sir came back.
Okay. Network issue was there.
Ah,
Hello, sir.
same
You
thing,
just left
same thing.
suddenly, sir.
No. Same thing happened with me. I think.
By the way, thank you, sir. That was a very excellent webinar, and I hope you come once again in our channel to do the same thing, sir. Over
Always,
to Dr.
always.
Viva, ma'am. Thank you, sir.
Okay,
Thank you,
so
thank you.
it wasn't really a wonderful webinar, sir. The cases you explained, the way you solve the cases, the explanation about the remedy, the analysis of cases, especially, everything was really something where we learn a lot from you, and we are looking forward again and again for learning from you, you, sir. So
Thank
thank
you.
you so much for giving this time of your to us. And I see one or two question in the chat box. If you permit, I want to read it.
I think there is one question: how to change other family members?
Yes, sir.
See, homeopaths are or homeopaths can play a good role as a counselor because of the way in which they apply logic in day-to-day practice. See, many times once insight is given, for example, I hope that after this presentation you are able to see some of the important tools hidden in the presentation, that this is the way in which analysis can be done. So what is this? It is direct or indirect input that we are receiving. So when we are dealing with a issue that is influencing the whole of the family members, then the counseling part will help. A family counseling session can be done. We can understand the different perspectives that each family member is having, and from that point of view, if the sensitivity of the family member to resolve that problem comes out very prominently, then definitely there will be a change in the outlook towards the problem. See, everyone wants to either be with the problem or come out of the problem. The approach will decide. So either counseling is the best thing, or we can define them also, and we will try to change them, and it is possible at some level, especially when the things are coming up at very early onset at the disease level. So that can be done. I hope the answer is satisfactory.
Yes, sir. Definitely. Another one is there from the same person. After
Okay.
some period, he faces some same problem in the third case.
Okay. So one more thing, that in this case, that the patient is still with me. Now the nature of problem is, or the nature of problem whenever he had consulted me, was not related to psychiatry. Okay. So whatever acutes are there, at that time only I prescribe acute remedy, and along with that chronic remedy. So that takes care of the whatever old lesions are there or old injuries are there at mind level that are means Natramur is helping in terms of restoring the sick to health to cure. Now the thing is that what if the same kind of problem comes up? See, depression is a common thing that everyone comes across throughout the life. When it goes to a diagnosis or up to the diagnosis level or where we need or where we seek, everyone never goes or everyone doesn't need to approach to a psychiatrist. So when a case has progressed to that level and it has been treated by a psychiatrist later on by a homeopath, and the homeopath has given result, and if again the problem is coming, so it is also like what we are having acutes. It is also having an acute exacerbation of chronic disease, like what we see with asthma or what we see with the upper or lower respiratory tract infection or any other GIT complaints. So whenever these kind of problems are coming up, we have to understand what is the cause. Every time the coryza will not be because of ice cream, or every time it may be because of ice cream, or every time it may not because of some other thing. Same way, when such kind of depressive episodes are coming, we need to understand the cause, the exciting factor that is underlying. The moment we are able to understand the exciting factor and whether the reaction is proportionate to that factor, it will definitely help us in terms of understanding the problem. And over a period of time, when we are giving homeopathic medicine or counseling at that period, definitely it will help. So it is one of the recurring type of disease that we can understand, but it is curable. We can cure that disease. That is very evident through vast literature that is available to us. So this is the thing. This is the explanation. And there are exciting factors in and around. The number of cases of depression or psychological disturbances were on the verge during this 6 months of period, what we had seen during lockdown. Many cases are there. So stressor will play an important period. So stressor is having an important role, and the disposition will also have an important role to play in terms of how to respond to that stressor. How we are taking up, that is also there. Okay.
Yes, sir. Yeah. So thank you, sir. You exploring all the angles of everything, and I thought not any other question here, but lot of
Okay.
appreciation messages are there. Everyone
Very good.
enjoyed this
Thank you.
session,
Thank you.
and I thought whoever just joined and those who are watching this video afterwards, as this video is available always on the YouTube, everyone is literally going to learn something or many new things from you, and the way how we can approach in the especially in the cases of mind or psychosomatic diseases. So thank you so much for enlightening so many things, and and thank you so much for your presence, sir. Thank you so much. And on the behalf of on the behalf of Aisha family, I like to thank all the participants, and I just want to inform all of you, tomorrow is the last day of our webinar series. So tomorrow Dr. Rakesh Gupta sir will be with us, and he is going to talk on the homeopathic cure in the eye diseases and related emergencies. So do not forget to join us again tomorrow for again to listen a wonderful speaker. And on this note, we are going to conclude today's session. Thank you so much, all of you. Thank you so much, team of Aisha, for always supporting us for the programs. Thank you so much, and good night. Thank you, sir.
Thank you. Thank you.